Welcome back, guys. In this video we are going to talk about fluorine intoxication, chronic benzene intoxication, and some kind of poisonings. It's gonna be the short video just to remember about different kind of poisoning and intoxications. Let's start with the video. So first of all, let's talk about the fluorine intoxication, also known as fluoride poisoning. So fluoride poisoning occurs when excessive amount of fluorine is ingested or absorbed. Fluorine is beneficial in small amounts for the dental health, but it is causing poisoning and problem with the teeth when it is in low amount as well as in high amounts. So the symptoms can be acute or chronic. GI symptoms can be there, neurological symptoms can be there, cardiac effects can be there, and chronic symptoms. The main chronic symptom which we will see in the KROK questions is dark yellow pigmentation of the teeth. Let's have a look over the questions. You will understand everything. First question says that it's 56-year-old patient who was working in the aluminium plant. So it was more than 20 years. So within the last 3 years, he developed the teeth bone joint pain and the piercing pain in the heart area, vomiting. So these are the symptoms of fluorine intoxication. What happens in the aluminium plant is, in the aluminium plant they use fluorine for the bauxite reaction. So the workers who are working in the aluminium plants are continuously prone to inhale the fluorine vapors. So basically, as a result, their teeth start to get problem. Let's go next. Next question. Next patient says that dark yellow pigmentation of the tooth enamel, diffuse osteoporosis, and CNS functional disorders. So this condition is caused by excessive concentration of fluorine. The question is simple. So next, how much should be the normal levels of fluorine in the water, or for example, optimal level of fluorine in the water? So it should be around 1. If you don't remember the exact value, just remember that in the normal values of fluorine in the water is around 1. So it is 0.7 to 1.2 milligram per liter. The question has been asked that Cary's morbidity rate is 89% among the residents of community. Determine the fluorine content in the water, which is 0.1% milligram. So preventive measures should be, so we know that 0.1 milligram is literally lower, or let's say the lowest. So the preventive measure, what should we do is water fluorination. We should add fluorine to the water so that they can get better. Caries are basically the tooth enamel damage and yellowing of the teeth due to the chronic fluorination. Next question says another child which got dental enamel erosions, yellow brown spots. So we know it is the symptom of high level of fluorine in the water. Another question, preventive examination of Ukrainian cities is spotted tooth enamel and generalized osteosclerosis with calcification of the intervertebral ligaments in 25 of residents. So I just need to remember that tooth enamel got damaged. It means there were high level of fluorine in the water. Also, we can remember that 25% is something the number for which we have to mark the excessive fluorine levels in the water. For example, I'm living in Katowice, Poland. So in the area Katowice, Poland, or in the region Silesia of Poland, there are severely low level of fluorine in the water. So basically, we are getting problems with the teeth and the yellowing of the teeth, or some teeth pain, or the losing of the gums, bleeding gums. So we are getting a lot of problem with the gums. So this is the photo which you can remember that dental fluorosis looks like this, or let's say the fluorine intoxication turn the teeth like this, something like this. You can see the dental caries, and remember, through the pictures I have highlighted all the text of fluorine intoxication with the yellow color so that you remember well. So Next is chronic benzene intoxication. So, chronic benzene intoxication is basically prolonged exposure to benzene or benzene compounds, or let's say aromatic compounds. So, people who are working in the plastic, resin, or some sort of plastic factories, those people are more prone for the chronic benzene intoxication. So chronic exposure can lead to the serious effects, particularly in the blood and bone marrow. So a main thing to remember about chronic benzene intoxication is this word plastic, which is highlighted very well. And let's say we know about benzene, that benzene is aromatic compound, so it will be given very well in the KROK question. Let's see some symptoms. If you can remember, it's good. If you cannot remember, just remember some few. So we will see aplastic anemia, leukemia, thrombocytopenia, neurorespiratory, dermatological, GIT, and other symptoms as well. A lot of symptoms are there, but the main to remember is there is aplastic anemia, leukemia, and thrombocytopenia. So we will see in the KROK question, the CBC values will be severely affected. So there is only one question in KROK which I found. So it's an elderly patient, general weakness, fever, shortness of breath, and frequent nosebleeds, works in the production of plastic where he comes in contact with the aromatic compounds. So as you can see, the CBC reports, erythrocytes are low, hemoglobin low, leukocytes are low, eosinophils are okay, band neutrophils, segmented lymphocytes. The CBC profile is severely affected. ESR is elevated. The platelets, thrombocytopenia we discuss in the definition portion. So thrombocytopenia is there. 30 are severely low. So when you see aromatic compound or the use of plastic, mark chronic benzene intoxication. Next is lead poisoning. So a lot of questions are there I have seen in the KROK exam for the lead poisoning. So this is something highlighting portion, and a lot of question will be there. Let's see how to solve those questions. So, lead poisoning is a serious condition, life-threatening condition, which is caused by accumulation of lead in the body. It will primarily affect the nervous system, kidney, and other organs. So, who are prone to this lead poisoning? The battery manufacturing people. I'll let you know why did I mark this much gray in color, because we are going to use this gray color in the questions. So, lead poisoning, battery manufacturing, construction worker, and painting people, people who are painting household products, or although painting was the paints were mixed with lead in the old times. Nowadays there is no problem in the paints or colors with the lead. And also when you see the battery manufacturing, so sometimes we can confuse the question with the carbon monoxide poisoning as well, because in the carbon monoxide poisoning as well, it can be caused by the batteries too. So we just by the way, there are different points to mark about the carbon monoxide poisoning. I'll let you know them later. So first of all, we just remember that lead poisoning is caused by battery manufacturer, construction worker, painting. Let's see the symptoms: high blood pressure, abdominal pain, cramps. So since it is damaging the nervous system, we know that nerve damage, kidney dysfunction, memory and concentration problems, joint and muscle pain. Let's see the question. So the question directly says whichever we have highlighted before, the car batteries. So the worker at the workshop that produces car batteries came to a doctor with the complaints of nausea, loss of appetite. So we see the GI symptom here: sharp pain in the abdominal cavity and constipation, elevated BP. So this was something written in the symptom, that it increases the blood pressure. Lead increases the blood pressure. Bradycardia, the patient noticed enlarged liver, and this is why I exactly marked the car battery as this much gray, because we see the grayish blue stripe of the gums. So let's see it. I have a photo. So this is how it will look. That's why I marked that car battery with this much gray color. So this is how the problem is going to look like. Also, you can see normal gums. This is a photo showing normal gums, and this is a photo showing lead poisoning line. So they call it Bruton's line. So you can see Bruton's line very well in this picture. So let's get back to the question. Now you know that grayish blue stripe on the gums will be caused by the lead poisoning. Also, there will be erythrocytosis, basophilic stripping, also the same thing. And they give the aminolevulinic acid in the question, but the main thing to remember is this grayish blue stripe. We are going to solve a lot of questions through this point itself. Let's go to the next question. So a man works in the casting of the non-ferrous metals and alloys for 12 years, and the air of the working area has high content of heavy metals, carbon monoxide, nitrogen, and many more. So the same thing, astheno-vegetative syndrome, like the coughing type thing, flu type symptoms, let's say cough, fever. Astheno-vegetative is simply a flu type of image. Sharp abdominal pain, we see the GI symptoms here. So blood, in the blood, main point is about the blood, reticulocytes and low hemoglobin. Low hemoglobin is, we know that it is the symptom for the lead poisoning. So we know what to mark here: lead and lead salts. Next question also highlight the basophilic aggravations. This is the same thing which we saw in the photo. So that stripping is also known as basophilic aggravation. So mark the lead poisoning. Another battery attendant is there, 39-year-old. So we know what to mark with the basophilic stripping of the question. Saturnism, also called as lead poisoning. So the KROK examiner may not always give lead poisoning in the bracket. We have to remember that lead poisoning is also known as Saturnism. So let's go next. If you want, you can pause the video and read the question maybe 2 times. I am just trying to highlight the main keyword because I know after this it will be easy to solve the question. So print shop, or let's say paint shop, in both of the things, the ink of the printing shop as well as the paint of the household products, so they include lead in this, and we are going to see lead polyneuropathy in this one. So a cable presser is there with the basophilic stripping, another patient, 30-year-old. So we know what to mark. For example, in this question, the KROK examiner did not provided the lead poisoning in the brackets. So we have to remember about the Saturnism. It's also known as lead poisoning. The pictures we have seen the Bruton's line in the animated photo as well as in the real photo. Let's go to the next portion. Next is aniline poisoning. So sometimes we may not misdiagnose the thing, because here is also a paint factory which we also saw in the lead poisoning. So the main thing to highlight here is Heinz and Lich bodies. So these bodies, when given in the question, mark the aniline poisoning, acute aniline poisoning, and we can have a look over the CBC profile of the patient in the aniline poisoning. There are erythrocytes are low, hemoglobin is low, so leukocytes are okay, ESR is okay. One more thing I wanted to tell is these Heinz and Lich bodies are the result of precipitation of denatured hemoglobin. So the aniline directly go and bind with the hemoglobin. So as a result, we see Heinz and Lich body in the question. Next is only one question for the mercury poisoning. The main thing to remember is the central paralysis, but if you want to see, it is the exposure to the mercury and its product toxics. Source can be workers, mining, smelting, cosmetic products. Mercury is used in cosmetic products as well. So some symptoms explaining this. There is elemental mercury poisoning, which is caused by thermometer, barometer, light bulb. There is some inorganic mercury compounds, skin lightening creams in some vaccines. It can occur from. There is some organic mercury poisoning which can occur from the shellfish. So no need to remember all of those things. Just remember for the KROK question that central paralysis, which I have seen in the questions of test center. Central paralysis is most important thing for the mercury poisoning. If you want, you can remember the blindness also. Here are the symptoms of mercury poisoning. If you want to see in the photogenic way, there will be kidney problems, severe headache. By the way, severe headache also occurs in the subarachnoid hemorrhage. The KROK question says something like the patient is agitated, the patient want to run somewhere, is it occurs in subarachnoid hemorrhage. Also, we can remember that in mercury poisoning also there is fatigue, tremor, insomnia, cardio problem, psycho problems, kidney problems. A lot of things are there. So let's go next. Next is carbon monoxide poisoning. So carbon monoxide poisoning occurs when the person is continuously suffocated by carbon oxide. So we all know that the carbon monoxide will go and bind with the hemoglobin and produce the product name as carboxyhemoglobin. So we can have a look over the symptoms. A mild exposure will just lead to headache, dizziness, nausea, and fatigue. Some similar normal symptoms as mild exposure. In moderate, there will be some shortness of breath, confusion, blurred vision, chest pain. In the severe exposure, we see that the person may have seizures, loss of consciousness, or the patient may die sometimes. We all know the stories about carbon monoxide poisoning in the cases of Ukraine. They burn some coal inside the room for the snowfall days, and we all know those stories, so they don't wake up again. So another question is there, forensic autopsy. So they have mentioned in the question about the carboxyhemoglobin levels are 55%. Cause of death should be what? Cause of death is monoxide poisoning. I have highlighted the question with the pink color because one important finding of carbon monoxide poisoning is the pink skin and mucosa. I'll show you the photo as well. So it is seen due to carboxy HB formation. So also a symptom of carbon monoxide poisoning. So normal level of carboxyhemoglobin are 1 to 2% in non-smokers. In smokers, they can be some up to 10% of level can be there, but in the non-smokers, just 1-2% sometimes, because it's present in the air as well. So it's normal, but 55% is significantly high. And another question is there. So the question says 40 to 50 minutes after completion of the repair work conducted in a closed garage. So garage with the car engine, they are highlighting about that car engine, car battery, and the same thing like that. So got the severe headache in the temporal area and vertigo, etc. So the acute poisoning occurred with the carbon monoxide. So remember about the car engine and car batteries separately. That car batteries we mark about the lead poisoning. And another thing to remember about the lead poisoning is that those Bruton's lines. So you can see the photo showing this pink skin and mucosa. So this is how the patient will look like with the carbon monoxide poisoning. Just before the death, the patient looks like this, severe conditions. So this is it with this video. I hope you are enjoying the videos. So if you have seen any another kind of poisoning in the KROK questions, feel free to tell me in the comment box. If there is any question which you are still marking incorrect, so I can let you know in the comments. So thank you for watching the video. Have a good evening.